Tonight I'm going to be, yeah, as Johan said, I'm going to be talking about the general care of canines or dogs, but in the context of the 5 freedoms, which I think you guys have heard about in previous talks. So just quickly, just to go over it again, the 5 freedoms are a group of internationally accepted standards of care regarding animal welfare, and it was developed by Britain's Farm Animal Council in the 1960s, when there was a concern about the welfare of, or the physical and the mental welfare of intensively farmed animals. But now, today, it's been adapted by shelter veterinarians for companion animals in shelters, but it's actually used all around the world by many animal welfare organizations to improve the welfare of animals. All right, so just to go through those 5 freedoms again, it's freedom of hunger and thirst, freedom from discomfort, freedom from pain, injury, or disease, freedom to express normal behavior, and freedom from fear and distress. So those are our 5 freedoms. Okay, so my talk is going to be focused on the behavior of normal and sick dogs, and then how we can use the 5 freedoms to help guide us as to, what is normal or what is maybe not normal for my dog or for your dogs that you guys are working with. Okay, so when we look at the first freedom, that's a pretty straightforward one, freedom from hunger and thirst. So a normal dog should eat when food is presented, or perhaps when you present a treat, and you should observe your dog drinking water a couple of times a day. This can obviously vary between dogs. Some dogs are fussy eaters, and they might eat a little bit now and a little bit later. Some, will gobble down their food all at once. So, but the more you work with your dog, you'll get used to what is normal for him or for her. Okay. The next freedom is, your dog needs to have freedom from discomfort. Okay. So a normal healthy dog will usually, if you provide some bedding or some shelter, it will use it, or it will seek it out. On a very hot day, a dog will usually go seek out some shade, or even go into the water if they're not too scared of water, like the dog on the bottom of that slide. Or on a, as the seasons get colder, they'll probably try and seek a bit of heat, maybe a bit of sunshine or a heater if that's available. All right. So a normal healthy dog that is free from pain and injury and disease will usually have a good appetite. It'll have a good healthy coat. It'll have a good body condition score. It'll show normal movement and activity. So it'll walk normally. It won't show any signs of discomfort, and it'll be just generally alert and active and responsive to its owner or to its handler. I just quickly want to go through this. I mentioned body condition score in the previous slide. So this is a tool or a chart that we often use as veterinarians to evaluate what the body fat score is in an animal. And depending on that score, you can see, okay, maybe this animal is maybe not healthy, but overweight, a bit underweight. So it's just a nice tool to use. So we usually focus on the ribs and on the waist and on the hips. So in a normal dog, in a dog with a good body condition score, you should be able to feel the ribs with flat fingers if you put your hands over the chest. The waist should ideally be visible, and you should be able to feel the point of the hips quite easily if you were to touch there. Okay, so it's basically these 3 areas that we focus on. There's your waist and then the point of the hips over there. So an ideal body condition score for a dog should be about between 4 and 5. I would say that's ideal body condition score. In a dog that's very active, they might be slightly under that score. And then obviously a dog that is really not active, not doing much exercise will have a higher score. Okay, so that's just a useful tool that we sometimes use yeah, with our clients. All right. Okay, so normal behavior, yeah, that can vary in individual dogs. And it often depends on the age of the dog, the breed of the dog, and what experience the dog has had in its past, perhaps as a puppy or growing up. Okay. But yeah, normal behaviors that dogs show is things like barking, chasing, chewing, digging, scratching, stretching out, and marking their territory, like that doggy in the bottom slide. You know, some of these behaviors are sometimes quite annoying to owners or to people, but it is considered normal. Yeah, and in general, a dog that's behaving normally will be social and playful and interactive with other pets or with its handler. So yeah, this is pretty straightforward. A dog that's free from fear and distress will show normal behavior, you know, so it sort of covers all those things that we've just gone through. Okay, good. Right, now we get into what an animal might show if they're not feeling well. Okay. So the behavior of a sick dog, basically the take-home message that I want you guys to remember is that there's usually a change in behavior. Okay. So if you guys are observing that your dog is changing in behavior, whether it be its appetite or its movement, you know, that usually indicates a problem. Okay, so look out for that change. That's basically what I'm getting at. All right. So a dog, yeah, with regards to its appetite and drinking, if it's got poor or no appetite, you know, that could be a problem. We call that anorexia. But a dog could also start eating more than usual, and that's a condition called polyphagia. A dog may stop or not stop drinking water, but start drinking very little. That could indicate a problem. But more often than not, they start drinking more or they start to drink excessive amounts of water. And that, you know, if you notice that change, that could potentially indicate that there's something wrong. Yeah, these things can also vary from dog to dog. Like my own dog is very, very food driven. So he will eat almost no matter what. Last year he was bitten by a spitting cobra, and his tongue was about the same size as his head, but he continued to eat. So I knew he was okay. If he had stopped eating, I would have known, shucks, there's something seriously wrong. So yeah, once again, just look for that change in behavior. Right, so the next few categories, we're just going to sort of put all together. So freedom from discomfort, pain, injury, or disease. Okay, so a dog that's suffering from discomfort or disease, or it's in pain, they'll usually start behaving or they'll become more quiet. They might become less active, and you can often see that this dog just looks depressed. They get this look about them. They often have a loss of appetite and body condition scores, so they start getting thinner. Some dogs become agitated or aggressive. A dog that's in pain or perhaps has an injury might start to limp, or it might be reluctant to jump up and down or run far distances. Some dogs start to lick at their feet or at a place that's sore, or they might start scratching. Some dogs start to vocalize or cry excessively. And then obviously, you know, if a dog is really really sick and in bad shape, you know, you could notice that they're shaking or they're trembling, or there could be rapid breathing. And then obviously some dogs will even collapse, and then, you know, there's serious trouble. Okay, so here's just a few pictures. So yeah, I'm just going to point here. So this doggy is obviously, it's got some sort of skin condition or skin disease. So it's been scratching and licking excessively there. And there's obviously, there's obviously infection there. Oh, sorry. Let's just get back there. There we go. Then, yeah, the doggy below it, you can see it's lost weight. Its skin doesn't look so good. And then the doggy next to it, yeah, it doesn't look very interested in its food. And then the one above it, yeah, that almost looks like a collapsed dog. So there could be quite a few things wrong over there. All right, let's carry on. So a sick or a distressed dog will often show a change in behavior. Okay, I'm going on about this, but that's important. You need to try and notice that change. Okay. We often see a change in behavior with dogs that have contracted rabies. Yeah, that is obviously quite a serious disease because it affects humans as well. All right. Rabies it's 100% preventable, but it is 100% incurable. Okay, so if an animal has rabies, yeah, it's basically the end of the road, and there's nothing that can be done. And unfortunately, that goes for humans as well. So yeah, just to go into rabies a bit, yeah, animals usually show signs of excessive aggression, salivation, agitation. So yeah, if your dog is usually quite docile and playful, if you notice that, you know, there's a change, there's something wrong. But you can also get the flip side with rabies, is that some dogs just become totally depressed and docile. Yeah, so once again, if your dog is usually quite active and playful and it suddenly becomes depressed and docile, and you know, there could be a problem. Okay. Some dogs also start to show obsessive behavior. Yeah, sorry, this is now not to do with rabies, but if they are feeling distressed, so they could start chewing, they could start licking, they can become very destructive, they often pace up and down. So that could be a sign that this dog is suffering from either some physical or some mental distress, you know, whatever the reason might be. Okay, so this is possibly what a rabid dog could look like. I mean, that's quite a spectacular picture there, you know, just teeth and saliva. And you don't really want to get bitten by this dog. But yeah, just to go back to this other slide, a rabies dog could look like this as well. Okay, so it can sometimes be quite a confusing disease. All right. So take-home message with rabies is definitely make sure your doggies are vaccinated against rabies, and sometimes it's good for you as or for us as humans to also be vaccinated against it. All right, and obviously people who are in a high-risk profession, it's almost always warranted. Okay. Here are just some examples of dogs showing sort of more obsessive and destructive behavior. Yeah, we've got a doggy there chasing its tail or biting its tail. There's another one that's ripped up, yeah, a book or something. At the bottom there, I think that's Johan's dog, or it could be Johan's dog, that chewed through the door, you know, for whatever reason, perhaps a bit of boredom or something like that. And then, yeah, also excessive licking, like that doggy is showing at the bottom right there. Okay, so yeah, just once again, for sick dogs, behavior-wise, there's always a change. Okay, and if you notice a change, one should ideally try and pay attention to that rather sooner than later. Okay, right. Then the next part of my talk is just on basic preventative care and general care of canines. So first of all, yeah, diet and nutrition. Dogs should ideally be on a good quality and an age-appropriate dog kibble, okay, or a dog pellet. All right. Some dogs that suffer from certain conditions, such as a skin condition or perhaps an intestinal condition, might require a prescription diet, but generally just a good quality kibble is adequate. Okay. Puppies, so a dog from up until 12 months should ideally be on puppy food, because the nutritional requirements are different for a puppy, you know, versus an adult dog or an old dog. Adult dogs should eat preferably adult dog food when they between 1 and 6 years, and then from 6 years onwards they are seen as senior pets, and ideally they should go onto a senior food. Okay, so these are just examples of dog food that you would find at a veterinarian or in your local supermarket or at a co-op. Okay, so over here is an example of a puppy food. Over there, yeah, this is more for a senior dog, so older doggy. And this is what we call a prescription diet. So we would generally prescribe this for a dog that has some sort of intestinal issue. Okay, so how do I know, ooh, my dog is on a good diet? There are a few things you can look at. You can observe the coat quality. Usually a dog, if it's on a good food, it'll have a good quality coat, so it's shiny, you know, there's no bald patches, nothing like that. You can monitor the body condition score, like we discussed previously. One can also, yeah, have a look at these stools. It is a bit gross and smelly, but often that can actually show you and guide you and say, listen, there might be a problem with this food. Okay. And then also, yeah, the amount of food that you need to feed. If the dog is on a food where you need to feed like 3 kilograms a day, then the quality is probably not great. If you have to feed a small amount a day, it probably means that it's quite a nutritious food, and the quality is probably a bit better. All right, grooming. So this is quite breed specific. You know, fortunately, you guys aren't working with little Maltese poodles or Yorkshire Terriers. So I believe you guys have Malinois dogs that you guys work with. So they have what we call a double coat. So they shed their coats about twice a year. So for them, grooming, a brush about 2 or 3 times a week should really be sufficient. One can also try and brush out any knots before you bath them, but yeah, they also don't need to be bathed excessively. I would say probably once every 1 to 2 months, or if they've become very dirty. Okay, then dental care. Yeah, so this is something we try and encourage our clients to do because yeah, it can really have a huge impact on a dog's health, especially later in life. Yeah, so you can brush a dog's teeth. That is something that one can do. It's best to start them rather sooner than later. So try and start doing that at a young age. One should use a dog toothbrush and obviously a dog toothpaste, and try and introduce it to the dog slowly. So let them sniff the toothbrush, perhaps let them lick a bit of the toothpaste. Most of the pet toothpastes are edible, so they don't need to spit it out or rinse it out. When you do brush your doggy's teeth, try and do it in a calm and relaxing environment, and then just take it slow. You know, do a few brush strokes for the first day and try and increase it as you go along. Yeah, do lots of praising and rewarding if they're sitting nice and still. Yeah, and you can probably build it up to about 2 to 3 times a week. Maybe give them a good toothbrush or toothbrushing. Yeah, toothbrushing is also a good time just to observe things in your dog's mouth that might also give you a clue that something could potentially be wrong. Something you can monitor is the color of your dog's gums. A normal healthy dog should usually have pink gums, but yeah, if you are brushing your dog's teeth and you see, oh, these gums are looking really red, or they're actually looking quite pale or even yellow, then you know there could potentially be something wrong. Okay. And then it also gives you an opportunity to notice, oh, is there not perhaps a little bone stuck, or a piece of grass or a piece of wood or something like that. If you're noticing that perhaps your doggy isn't eating well, go look in that mouth. There might be something there. All right, parasite control. So dogs get what we call internal and external parasites. We'll start with the internal parasites. So those are basically intestinal worms. Those are the most common internal parasites of dogs. And dogs usually suffer from roundworm or tapeworm infestation. we usually just recommend that one uses a broad spectrum dewormer for an adult dog. I would say about every 3 to 4 months should be sufficient. Puppies sometimes need deworming a bit more often, perhaps once every month, once every 3 weeks. But usually in an adult dog, every 3 to 4 months is fine. Then external parasites that we see on dogs, the most common ones are ticks and fleas, and then we also get mites, and we also can get lice on dogs. Ticks are quite an important one because they transmit a disease called tick fever or biliary fever, which you guys probably have heard of in previous talks. Dogs, if they do contract this disease, they can, or they get very, very ill, and they can die from it if they haven't been treated. Okay, so signs to look out for just quickly in a biliary dog is, they usually go off their food. They become quite lethargic, and when you look at the gums often have a very pale appearance, or even a yellow appearance. Okay, then it's quite advanced. All right. The best way to prevent these dogs from contracting this disease is through practicing effective tick control. All right. So fortunately, today there are many products available that are very effective when used correctly. Okay. One gets tablets that you can give to the dog to eat. You can give a pour-on onto the skin that'll kill these ticks. You can also get tick collars and things like dips and shampoo. Let's just go through. So here here's just a few examples of the products that are available on the market. This top one here, this is what we call a pour-on. So it gets applied to the skin, and it'll kill ticks and fleas on the dog for a certain period of time. Below here is tablets. So these are they're fairly new. So this is a tablet that the dog eats, and then that poison actually goes into the bloodstream, and if a tick or a flea should get onto the dog, it'll die. And then we also have your shampoos. They also work quite well. And then dips at the bottom here that you mix with water, and you sponge your dog down or dip him into the solution. All right. It's most of these products are very effective. Some are a bit more convenient than others, but I don't think there's a right or a wrong product out there. It must just be used correctly. All right. So that looks like it's the end of my talk. Thanks again for letting me present to you guys, and I'd be happy to take some questions if there's anything you'd like me to repeat or to clarify. Please feel welcome to ask.
My question is, what causes the internal parasite inside the dog, and how can I know that my dog is sick of the internal parasite?
Oh, okay. I think I got that. So where do the internal parasites come from? Did I hear correctly? Internal parasites or worms, they're usually contracted from the environment where worm eggs and worm larvae live. And then dogs, through sniffing, often they ingest these eggs or larvae, and those then develop into adults in the dog. So signs to look out for, you might see adult worms in the stool or in the feces. Sometimes one can observe that. So tapeworms, usually they might look like a little rice particle, or you can see a long, nasty, long worm. And then other symptoms that they will show, but that's usually a dog with a very heavy worm infestation. It'll start losing weight. It'll have a poor body condition score. And when you look at the gums often appear pale, because what these worms do is they cause little sores in the intestine, and the dogs then slowly lose blood through there. So they develop what we call anemia, and that often can be seen as pale gums. All right. So those are signs to look out for.
So during the talk, I just want to know some other times when I saw the dog used to browse the grass, the green grass, in order to vomit. Can you tell more? Can you tell me
Okay. Yeah.
more about that?
Okay. Yes. Yeah. Yeah. That dogs do that. Sometimes if they feel nauseous, they will eat grass and then vomit. I think it actually helps them to bring up whatever they want to bring up, or to vomit up whatever they want to vomit up. It's not necessarily a problem them doing that. Some dogs might do that once or twice in a day, and then for the rest of the day they're normal, and for the next day they're fine. Then I wouldn't worry too much. Okay. But if your dog is doing that a few times a day, and it's doing it for a few days in a row, and especially if the dog is not eating anything else, yeah, that is a problem. Okay. Yeah. So it is a normal thing that dogs do, but vomiting and showing that behavior all the time is not normal. Yeah.
Hello, everyone. I'm
Hello.
Catrien. So my question is that when it comes to the food, sorry if I make a mistake, but I saw you showing different types of food.
Yeah.
So now my dog she's having a lot because she get a packet of food. Now she's almost 9 years old. So the food that I got it now here to give it to her, if I can give it to her and then she's going to start eating, it won't cause any allergic, or because normally they normally eat pap, soup, not those food that you show us on the screen.
Oh,
So there's no allergy when it's come to the food, because it will be the first time eating this food.
yeah.
So I think you heard that question.
Yes. I just want to confirm that I'm understanding correctly. So your dog needs to go onto another food, and you're concerned about allergies, am I right? Or some that it might not agree with her. Am I hearing correctly?
Yes, yes.
Okay, yeah. Yes, I mean that's a good question, and some dogs are sensitive to certain ingredients that occur in all foods. Yeah, so we call it basically a food allergy. It's it's not that common, but it's not impossible. Okay, so usually what I say to my clients, if they are changing their dog from one food to another food, is try and do it slowly over a period of a few days. So you can give it about a week, and let's say for the first few days you mix um, let's say 75% of the old food, and you add 25% of the new food. Okay, so you do that for a couple of days, and then after 3 days you give it 50-50, and then for the next 3 days it's more of the new food and very little of the old food. Okay, so first of all, it gives the dog a chance to just get used to it, because some dogs are quite fussy. They won't just change from one food to another. And it also gives the digestive system a chance to get used to it. Yeah, so I would say it. Yeah, although food allergies exist, they're not that common. And if you transition your dog slowly, there shouldn't really be a problem. Okay. Obviously, signs to look out for a potential allergy is, I would say, yeah, vomiting, diarrhea, and some dogs can even develop like an itchy skin. Yeah, so maybe if you do notice that, yeah, then it could be that perhaps your dog is perhaps allergic to something in the new food. All right.
Okay.
Okay.
So you were talking about the pills there on the screen, the pills to help the ticks out on the dogs. So how can I give my dog the pills with water, or because normally human can take the pill inside the mouth and then drinking
Yes.
water. So what about the dogs? How can I give the pills?
Okay. Yeah. So fortunately, the a lot of these tablets are flavored. Okay, so when the companies develop these medications, they actually make sure that it's got a nice flavoring to it. Okay, so most dogs, if you give it to them, and I say most dogs will eat it. Okay, so you just offer it to them in your hand, or you can even put it in their bowl of food, and they'll just eat it. They're not going to know, oh, it's a tablet or it's medication. Some dogs are a bit more tricky, and they are quite fussy, and they won't just eat anything. There you have to, I think, yeah, just open the mouth and shove it in. That's usually what we do. Yeah. But otherwise,
but-
you can hide it in something nice to eat. Yeah.
Okay, but what if I put inside the water to melt it?
Okay.
Water, is it a cup or
Yeah, I probably wouldn't put it in water, because you'll probably need to use a lot of water to dissolve that whole tablet, and the dog will probably not drink all that water at once. So I would advise don't dissolve it in water. If you feel, or if the dog doesn't want to eat it by itself, then I would rather maybe hide it in something nice. So maybe a little piece of bread, or if you have any like mincemeat or something like that, try and hide it in there. Yeah, I wouldn't dissolve it in water, not the edible tablets. Yeah, all right. But yes, like I say, with the development of these tablets, the companies put a lot of effort into making it tasty for the dogs. So let's say 8 out of 10 times the dog will probably eat it if you give it to him. Okay. All right.
So
Good.
last question. I saw one of the dogs at home. When they poo, those poo was not okay. It's like it's not normal poo that I used to see from different dogs. So which means it's a sign of sickness or what?
It can be. Yeah, it can be, yes. It could be a sign of illness, so that there's actually an infection in the intestine or in the large intestine. It could perhaps just be that there's been a change in the intestine of the dog, and maybe it has a bit of diarrhea. It could be a change in food. I would say if it lasts for more than 2 days, and especially if the dog stops eating or is showing other symptoms that it might not be well, so it's not eating, it's looking depressed, it's vomiting, then yeah, that could be a problem. Okay. If the dog just has a bit of an abnormal stool for a day or two, but it's acting normally otherwise, so it's still eating, it's still playful, it still wants to work, then I would probably just monitor it. Yeah. Okay.
Okay.
All right.
Thank you.
Good.
Catrien, if I may just demonstrate, this is Bravecto.
Yes.
This is, and if you want to have a look here, I don't know if you
Yes.
can see there, but the dog is very keen to eat it.
Doggy
Like-
wants.
Oh,
Yes.
Taking it out of the,
that's
she'll
fine.
take it out of the, yeah, she wants it.
Okay.
Yeah.
Oh.
Yes. That's how most dogs react to it. Good.
Yeah. So I will try my best to teach my dog how to eat those peas or what.
Yes. Yeah. But if you battle, you can hide it in something tasty. That's what I usually say to my clients or to my owners. Yeah. If they say the dog is difficult to give tablets to, then that's something you can try. Yeah.
Oh, okay.
Good.
Thank you so much. I'll add that to my dog.
My question is concerned more about the body count or the body condition. If my dog is under ideal, I guess it's because I'm not feeding it well. But if it is over ideal, what can I do? Can I put it on a diet like myself?
Yes. Yes. And yeah, that is a problem that I see every day. And yeah, I'm sad to admit, even with my own dogs, yes, overweight dogs are a problem. I think we tend to overfeed our dogs because for us it's a way to express our love. It's to, oh, here's some more food for you, or here's something nice for you. Okay. So yes, that can definitely happen. Yeah, and obviously an overweight dog, it can also, that is negative for its health. There's many problems that can occur, things like joint problems and heart problems and liver problems. So yeah, it's not good for them to be overweight, definitely. So yes, you can absolutely put your dog on a diet, and yeah, try and, it's like with the humans, you know, diet and exercise, that should help it lose a bit of weight. Yeah, all right, in most dogs, yes.
So my last question is, how many times do I have to exercise my dog a day?
Oh, okay, yeah. All right. Yes, that can vary once again between dogs. I would usually, if it's a large breed working dog, you know, that you guys, you know, have there, I would say probably anything from between 30 minutes to an hour every day. Yeah, but also, you know, start slowly. You don't have to, on day one, you don't have to go run 10 kilometers with it. You know, the dog will probably collapse or get heat exhaustion if it's not fit. So you can slowly build it up over time. But yeah, I would say half an hour to an hour if possible. And then, you know, I guess when you guys are doing work and, you know, they tracking spurs and things like that, you know, that is also a form of exercise. Yeah. All right. Good.
Okay.
Can I please specify something? Some of the members do not work with the canine dogs in particular, but they have the dogs at home. So
Oh,
does
okay.
does that apply to normal small dogs?
Yes, yeah, ideally, yes. I mean, yeah, it is sometimes difficult to find that time. You know, I find myself, you know, I often battle to fit that in as well. But especially with a breed like the Malinois, yeah, they do need lots of stimulation and exercise. You know, it's good for them. It's good for their mental well-being. So if one could aim for about 30 minutes a day, that'll be good. Yeah, you'll have a dog that's happier and probably showing less destructive behavior or things like that. Yeah, because they can be quite a handful, I believe. Yeah.
Thank you so much for the answer.
Hi everyone, my name is Leita. I want to ask about the dogs in the village. So I once saw a dog that gave birth to 4 puppies, and that dog ate 3 puppies and left with 1. Is it normal for a dog to eat a puppy after?
Yeah. Yes, it is. You know, yeah, I do hear that from time to time, where I have clients coming in, you know, where they said, oh, their female had puppies, but she ate all the puppies, or she ate 2 or 3, like you described. Obviously, it's not something nice. We don't like to hear that. Yeah, to be honest, I don't know why they do it. Sometimes it could be if it's a first time mother and she is very stressed during the birth process or just before it, you know, it is just sort of a normal reaction for them. But it's not unusual. It's not pleasant, and you know, one thinks, gosh, how can they do that? But yeah, it can happen. It can happen.
Okay. So yesterday we were talking about dogs and snakes, since we are working in the bush and you can be walking with your dog and then a snake bite it.
Yes.
This question came back after the talk. So I would like to ask, what kind of snake can bite a dog and the dog die? And how long can it take? I can ask about the puff adder, because it
Yes.
is one of the venomous snakes. So I want to know if it can bite my dog, how long can the dog survive, and how, if I have to be in hurry to save the dog and take it to a doctor.
Yes. Yeah. Yes. Well, in general, snake bites are usually quite serious. And I would say definitely if it's a venomous snake to humans, you can assume it's going to be venomous to your dog as well. All right. Yeah, a puff adder bite, that, yes, that is one of the serious ones. And preferably your dog should get veterinary attention, as soon as possible. Okay. Whether your dog receives anti-venom, that will depend on each case and how the case progresses. We've had instances where, or at our clinic or at my work where, the owner said, oh, my dog was bitten by a puff adder, and you can see that there's swelling, but the dog actually does okay, and we actually we don't need to do very extreme intervention, but some dogs arrive by us collapsed, and then we know, okay, shucks, we need to get this dog on a drip, get some anti-venom into it. Yeah, so ideally, I would say if your dog is bitten by a known venomous snake, yeah, at least just take it in for a checkup. Obviously, if it's looking very collapsed very quickly, yeah, then it's an emergency. Then it needs to get to the vet. Yeah, ASAP. Yeah. I was wondering, have you guys got a veterinarian in your area? How close is the closest vet to you guys?
Yeah, we do have a dog veterinarian in our area. It's nearby. So some villages, they don't have it, but where I'm coming from, we do have it.
Okay, all right. Okay, well, that's good to know that there is someone in the area. Yeah, at the moment, snake anti-venom is a bit of a problem. There is a bit of a shortage in the country, unfortunately, and it's the same venom that they use on people. We don't have a special dog anti-venom. It's actually the one that gets developed for people. And yeah, at the moment, yeah, obviously the human hospitals will get preference for anti-venom. Yeah, so it is a bit scary at times when you think, shucks, I could see a serious snake bite and I don't have any anti-venom. But yeah, fortunately we are going into the cooler months, so hopefully the snakes will start going away. And when they come back in summer, we'll have more anti-venom again.
Okay, thank you.
Good, pleasure.
May I ask a follow-up question on Latest question? Sorry,
Yes,
I'm taking
yes.
part.
No,
Is there something, can they, like, if it's bitten on the leg, can they
yeah.
put a tourniquet on, or just to stop the venom from going into the bloodstream, or?
Yeah, no, that's actually not advised. No, tourniquets or cutting the wound, things like that, or sucking out poison. Yeah, please don't do that. Yeah, I don't think you're really going to make much of a difference. Yeah, rather just get it checked out, and if possible, try and identify the snake. I know it's not always easy, because you're quite stressed and you probably get a fright yourself. I know I would run a mile if I saw a snake. But if possible, just try and identify the snake. Yeah, you don't have to kill it. I'm not saying that. But if you are quite familiar with snakes, hopefully you can say to the doctor, okay, listen, my dog's been bitten by a puff adder or a spitting cobra. Because the other thing is also, not all the snakes are covered in the anti-venom. So something like just trying to think, like a night adder bite. Some dogs get very sick from that, but that's actually not included in the anti-venom. So if the owner says to me, listen, my dog was definitely bitten by a night adder, I'm not going to give it anti-venom because it's going to be a waste. Yeah, and it's probably not going to do much. Yeah. So try and ID that snake if you can. It often helps the doctor to decide, and obviously also what signs to look out for, because each snake venom has a certain effect on the body. Yeah, so it will help them to know what to look out for and monitor for. Cool.
Okay, thanks, Catrien. Next question.
Hello.
Hello, hi.
I want to ask about the worm that lives underneath the tongue of a dog. Is it true that you can cut it out and remove it, the dog will grow stronger and healthier?
All right, yeah. Incidentally, I get asked that question quite a lot where I work. So fortunately, no, there's not a worm under your dog's tongue. Okay. If you lift up, I'm not going to do it now, but if you look in the mirror tonight before you brush your teeth and you lift up your tongue, you'll see there's like a little piece of muscle or meat under your tongue as well. Okay. So that is just a normal part of the anatomy. Okay, it helps to keep the tongue in place, and it helps it to work, you know, if it has to chew or pick up food or help with chewing and things like that. Okay, so yeah, just to answer your question, no, there's not a worm under the tongue, and one should please not cut under the tongue because you'll cause the dog lots of unnecessary pain, and it'll actually probably stop eating for a few days because it's just too sore. Okay. If you remember in my slideshow, worms, they normally, or the common ones, just live in the intestine. Okay, so not in the mouth, not under the tongue. Okay, so if you hear of anyone doing that, you know, maybe try and discourage that, discourage them from doing that, because it's a bit of an old wives' tale. Yeah, but I know a lot of people believe that, but it's not a worm under your tongue or under the dog's tongue. Okay.
So what about the worms that are on its body? Because sometimes you see worms and then they will split it out and then it will come out of the dog.
Yes.
Do you know that?
Yes, I know about that. That I think you're speaking about what we call a mango worm, and I know it is in certain areas of the country. It is more prevalent. So yeah, basically, if I remember correctly, it's I have to think very far back now. You see, I've already forgotten about it because I don't see it. I think it's a fly that lies an egg in the skin, and then that worm that you see is the larvae. Okay, so treatment for that, I would think would need to be some sort of I'd have to Google it, probably some sort of ivermectin, I think. Yeah, but it is in some areas it is a common condition, you know, and it's quite bad to see that, and some dogs can really have quite a severe infestation. So yeah, I think if you do see something like that, definitely take the dog to the vet.
Catrien, if I can also just encourage you, the doctor that's going to be speaking to you on Friday will specifically address the issues regarding things that you might see in the village.
Okay.
And
good.
also she's from a tropical area, whereas Catrien is not so much from a tropical area. So it will be from the same climate as you are, and therefore she will know that probably that she would have encountered it more. So just save that question for Friday again, please.
Hi, I've got another question. Is there any trauma that a female dog face? Most of the time we see when they give birth, people are taking those puppies, sell them or give it to other people. Is there any trauma that that dog face? Because I'm just like wanted to know. I've seen it happening most of the time in my videos. People want those young puppies and they say they want to grow it themselves while they're still young, but not thinking of the mother.
Yeah, that's a good question. Yeah, it's a very good question. I think I don't know if dogs feel the same emotions as we do, but they can definitely suffer. Okay, that there's no question about that. Okay, so if that mother dog realizes or feels like humans do, you know, if someone had to take away my baby or my daughter, I'd be absolutely devastated. I don't know if dogs have that range of emotions. You know, I think that's up for discussion. But yes, sometimes their behavior can once the puppies are weaned or taken away, you'll find that that mother is looking for the puppies. She'll sniff around and she'll probably still produce milk and start licking objects or something like that, as if she was still nursing a litter of pups. Whether there's that emotional feeling or that sadness, I don't know. Unfortunately, we've been clever with lots of things, but I don't know if we haven't quite grasped what animals feel, and if they feel the
Yeah,
same
but
way.
the behavior of the dog does show that maybe that dog is in pain. Like as you said, with the linking of milk, that shows that the dog still wants to breastfeed.
Yes, yeah. Listen, a lot of it is also driven by hormones, so it's her brain sending signals in the bloodstream and to different organs. So when you speak about pain, are you meaning emotional pain or physical pain or?
Actually, there was nothing in my mind. I just wanted to understand if is there any suffering that the dog is going through, or, like changes of behavior or being aggressive for that certain time, and then changes of behavior that shows maybe the dog is now fine and so.
Yes, yeah. No, I think change in behavior can definitely be there. And I think sometimes some dogs get quite stressed when their puppies are taken away, especially dogs that have been very good mothers, so they'll, they nurse the pups, they clean them, they lick them, they take them everywhere with them. But whether, the emotion that we ascribe to us humans is the same as with the dogs, I don't know. Yeah. But behavioral changes, yes, that can definitely happen. Yes.
I've also watched a few videos of dogs that has been separated, or one dog went missing, and when they unite them, you can tell by the way they are running into each other, starting playing. That's now they recognize each other, and
yes, no, definitely. Yeah. I think there's a lot about dog behavior and dog emotions, if I can call it that way, that we don't know about and that we don't understand. Yes, it's fascinating seeing videos like that. Yeah, and I would say definitely there is a connection on another level that we don't know and we don't understand. Cool, thank you.
Later, sorry, don't go away. I want to ask you a question, please. Later. So we've recently on share screen had expert, a lady who's a psychologist. In other words, she's a doctor of the mind, and she's also a doctor, a physical doctor, a medical doctor. And she's got a degree, and she's also an expert in ecology. So she was observing elephants, and and they did a whole range of experiments on the elephants in terms of if the elephants miss each other and if they know each other, and they did a whole range. So my question is, have you in your work seen behavior with the wild animals that you see that indicate that they know each other or they meet each other? Have you seen that with lions or elephants or anything else?
I think I've seen it with elephants. One elephant died. I think it was it was killed by it was killed by a train, because inside the reserve where we're working, we have a railway line. So that elephant was hit by a train, and then the other elephant came. Like their emotions were very much sad, and they were gathering together where the elephants died, and they spent some time there. And even if they move, but they will still come back there like they are mourning. So that's where I've realized that I think elephants are feeling the same pain that we're feeling when we have lost our loved one. And I've also saw two young elephants. The other one was was drinking water, and then after it wanted to came out, but it couldn't because there was a small hill. And then the other elephant was trying to push the one who was failing to move out. And then I saw the mothers came trying to push that one. So that's when I realized that they know about death and they don't want to lose that small elephant. That's why they all call each other and came gathered there and tried to help that small one and survive. I also went to Rhino Revolution where we were looking after the rhino calves that their mother were killed by poachers. So one of the young rhinos that came there was, I think it was 2 weeks old. When it arrived there, it used to hit its head with a wall. So when I asked why it was doing that, they said it's the trauma that rhino went through. They killed the mother in front of her, and she was running around trying to disturb them, but they pushed her away. And then she was in the bush for 5 days alone. So she was still young because she still needed a mother to teach her how to drink water, how to fight for herself, and so many things. So that's what I've seen. And while we were feeding them, we used to feed them 5 liter in the morning at 6, and then after 4 hours again, we would feed it another 5 liter. So after feeding it, when that 5 liter is finished, it was going to call for more, like feed me more, I'm not full. And then it would call you when you walk away from it to come back, bond with it. When you sit down, it would come with that big head, put it on top of you, and then it wants you to scratch it. And when you're busy scratching it, you can see that the rhino is excited and the rhino is enjoying you being around her. And whenever you communicate with it, you would see the response. It would call you and you would call it back. Whenever you call it, even if it's sleeping, they will just wake up and come running for you. So that's where I've gained a bit of knowledge about the animals' behavior, how they feel when we mistreat them and when we treat them well.
Seems to me you gained a lot of knowledge, not a little bit.
Yes.
And thank you for that, because, you know, not everything you can measure or prove, but you can see it and you can feel it.
Yeah. Thank you.
Thanks for your question.
Thank you.
I have another question. Do I have to worry if my dog has a anal sac infection, a glands, a whitish, watery gland that smells like fish from the anus?
Yes. Oh, okay. Yes. No, that is, in most cases, it is usually normal. It is a normal discharge from the anal glands, and it's got that horrible smell. It almost smells like fish. It's a really horrible smell. But dogs usually, when they're defecating or if they get a fright, those glands express, and that's often when you get that smell, or you might see the discharge around the anus or on the tail. But yeah, that's fairly normal. Okay. Usually, if there's a problem, you'll notice other behaviors that the dog will show. So if you have a condition called impacted anal glands, so those glands get clogged up, if I can put it that way. So what you might notice is your dog, you could be licking under his tail excessively or around the anus excessively. And something else they do is we call it scooting. So they go and sit on their bottoms and they literally rub their bottoms against the floor. It looks, I don't know how to describe it. They'll go and sit. It almost looks human-like, they're sort of scooting to just try and relieve that irritation. Okay. So if you see the discharge or you smell the discharge and the dog is acting fine otherwise, then I wouldn't be too worried. It is unpleasant, I agree. But if you see that your dog is licking, showing that scooting behavior, then yeah, you should probably take it to the vet. And then what happens is that we can express that gland that has become clogged. Or yeah, there we go. Thank you, Mariette. Yeah, so they literally do that. It looks terrible, but that's what you see. Yeah, thanks, Mariette.
Okay.
Okay, cool.
Ah, goodness, hold on. That's a good evening, everyone.
Good evening.
My question is, let's take, I have 2 dogs at home, and the other one suddenly get a disease, infected by disease, any of them that you mentioned here. Will the other dog get infected if they don't get isolated to each other, or they can continue to stay together?
Yeah. Unfortunately, it depends on the disease. Okay. If it is something infectious, something like a viral disease or a bacterial disease, unfortunately, yes, then chances are quite good that the one dog will spread it to the other. But in saying that, it also varies from disease to disease. Some viruses are highly contagious, others are less so. Yeah, let me just think. Just for example, things like parvovirus and distemper virus, which you might have heard of, or you might still hear of it in talks to come. Those are quite contagious, and if I diagnose a patient with that, and the owner says to me, "Listen, I've got other dogs at home," then I would usually say to them, "Yeah, rather isolate your sick dogs from the healthy ones." Less serious things like, fleas and ticks, yeah, that can also spread between dogs. So yeah, if one dog has a lot of fleas, it's a good chance those fleas are going to get off and get onto the other dog. So yeah, if ideally you should try and isolate your sick patient. It doesn't matter really what the disease or the condition is. Ideally, you should isolate them. And yeah, just try and treat them effectively, and maybe even treat the healthy dog as a precaution, especially when it comes to things like external parasites and internal parasites. Okay, yeah, you can't always treat preventatively for viral diseases and things like that. Well, you can vaccinate, obviously that's very important. But yeah, ideally isolate that dog for a certain period of time, but the doctor or the veterinarian should be able to guide you with that, say, listen, a week or 2 weeks, or yeah. All right.
Okay, thank you.
Okay, thank you.
Any other questions today?
Hi.
Hello.
When my dog's fur is starting to fall off, and what kind of
Oh.
condition is it?
Okay, the hair starts to fall off, and what condition is that? Okay. So listen, all dogs will shed hair. If you brush your dog and there's hair that comes off, or if you notice there's hair on your clothing or in the car or in the house, that's normal. Okay, they do lose hair like we lose hair. If your dog is losing hair and you can see that there's patches of skin without hair, okay, that is usually a problem. Okay. There are quite a few conditions that can cause that. I would say the most common condition for hair loss, and especially if a dog is also itching. So you see the dog has got patches where there's no hair and the dog is licking there or scratching there. I would say 9 out of 10 times, it's some sort of skin parasite. Okay, so something like fleas or perhaps mange or even lice. Okay, so then fortunately those are quite easy to diagnose, and they're quite easy to treat with the products that are available to us today. Okay, in less common instances, it could hair loss or excessive hair loss, and especially if there are then patches where the dog becomes bald, could also mean other issues, and I'm thinking about sort of metabolic or endocrine conditions. Okay, so that means that there's something wrong with one of the glands in the body, is either secreting too much of a hormone or too little of a hormone. Okay, those can be a bit tricky to recognize and to diagnose and to treat. Okay, but I would almost put my head on a block and say, if you have a dog that's got bald patches and it's licking and it's scratching, 9 out of 10 times it's probably got some sort of skin parasite like a flea. Okay, and then that fortunately is quite treatable. All right. Okay,
So
but yeah, and just to get back to your initial question, but yeah, brushing your dog and seeing that hair's coming out, but the coat otherwise looks good, I wouldn't worry about that. Okay, it's probably just hair loss. All right.
Okay, so it is true that when it is feeding with fish bones, it can also cause that hair loss, where you can
When you are
even see
feeding
the
it?
skin of the dog. Feeding it with fish bones, where you can
okay.
even see the skin.
I just want to understand, have you seen that, or are you asking, can it cause that? Or have you seen it happen?
Yes, I once saw a dog where I can even see the skin, and then some said that is because the dog has been fed with fish bones. So it is true.
Yeah. Okay, listen, yeah, I mean, if that fish bone, I don't think it's probably not very nutritious. So yes, yeah, sorry, that's something that I didn't mention is if you have a metabolic disorder or some sort of severe deficiency. Okay, yeah, so that would make sense. If a dog is just eating fish meal, it's probably lacking lots of important vitamins and minerals and things like protein and carbohydrates that the skin needs to grow hair and to repair. Then I would say you could see excessive hair loss or hair loss and the hair is not growing back. But then you'd need to know that it's only been eating fish meal. But that can happen. That's a good point. It's a good point.
So what can I do about that situation?
One should ideally change the food. Try and get it onto a more balanced diet.
Okay, thank you.
All right, pleasure.
Any other questions? Oh, Colin. We have this today.
So guys, I just want to know that how many times must I feed a dog, or must I feed it?
All right. I just want to confirm, how many times do you need to feed a dog per day? Am I understanding correct?
Yes.
Yeah. So that I think that depends on the owner and on the dog. Okay. And it also depends on what you are feeding. Okay. So most commercial dog foods, if you are feeding a commercial dog food, it gives you some sort of indication as to how much a dog needs in a day. Okay, so brand X might say for a dog of this weight, it needs 200 grams of food a day, and the next brand might say 300 grams a day. Okay, so I always say to my clients, listen, you can feed your dog 10 times a day if you want, but in 24 hours, it needs a certain amount of food to have gone into the body. Okay, so personally, I prefer feeding twice a day. I feed my own dogs twice a day. Some of my clients feed their dogs once a day. But as long as they're getting the amount that they need in 24 hours, I don't think there's really a right or a wrong answer. Yeah.
I just wanna know, like normally around the villages where we're coming from, the dogs they chew the bones. Like when we see the dogs from movies and normal dogs all over, they can take the bones and they hide the bones. So like how giraffes do dogs do gnawing of bones, like obtaining the calcium out of the bones. Is it a dog thing also?
Ooh, I think maybe some dogs, yes, if they're suffering from quite a severe calcium deficiency, they might do that. I think hiding bones and things like that is more a behavioral thing. You know, it's sort of in their nature or their instinct to do that. But I would say a dog that's on a fairly good food probably won't have a calcium deficiency. So he's probably eating that bone or chewing on it because he likes it. You know, he likes the taste, or there's probably still a bit of meat or fat in there. Yeah. So I think that's probably why they do that.
Valeria, and ladies, gents, thank you very much. It was super interesting tonight. I see another hand going up. Okay. It was lovely to spend time with you, and very interesting. Your questions were really, really good questions. Thank you for asking them.
Thank you.